But I want to talk about the Litchfield double murder that's been happening this week. So let's take you back real quick. I'm going to recap it for you right here. Tuesday, welfare check at a home there in Litchfield Park. The search began for a missing mother, father, adult son. There were signs of foul play because there was a large amount of blood. Well, yesterday, investigators dug up the bodies of two people buried in the backyard. This case is now a homicide because those bodies, they have been decomposing this past week, and really who knows how long they have been decomposing. So now the latest, an international search is underway for the son who is believed to be the alleged suspect in this case, 27-year-old Matthew Flores. So now let's do a follow-up. Right now with me, I have Dr. Anna Shier. She's also a psychologist. And I really want to dive into this mental health illness, almost epidemic that we seem to be seeing lately. I mean, we just mentioned this Litchfield Park double murder, that the son is an alleged suspect, possibly killing his parents. We just talked about the wildfire suspect up in Spokane, Farinacci. He was convicted of killing his adoptive father in their home back 16 years ago. We also have a couple more cases. There was a Peoria case back in April, if you'll remember. This one was very disturbing. The son allegedly stabbed and killed his parents at their home because they were making him take his medication. And then in a more national scope, this was very high profile, NFL star Calais Campbell. You remember him from the Arizona Cardinals. All right, well, his brother is accused of killing their own mother in their Atlanta home. So, and on top of that, he's got a history of mental illness. So why is this happening? Is this coincidental, or does it seem that, you know, children are killing their parents? It just seems as though there's been a rash of them.
I could definitely see how it does look that way, but when you look at the overall percentages, typically parricide is the name for children who kill their parents, or patricide for the father, matricide for the mother.
Okay.
Out of all the national homicides, it's only about 1%, maybe 2%, depending on what sources you're looking at, out of the entire pool of homicides. And it hasn't actually been much, it actually hasn't spiked from the baseline.
Really?
I think for whatever reason.
So is it
it's
coincidental?
Close to home. Coincidental, it's close to home, but also we just see so much so quickly, so rapidly. And when we are, you know, interested or scared or appalled, we tend to engage with stuff more. And so I think our algorithms are just primed to show us that over and over.
Yeah, but you know, it makes me think, I know we blame social media for a lot of things, right? I mean, and it has been shown that it is not great for our mental health. It makes me think that, you know, back growing up in the 80s when we heard about the Menendez brothers, my gosh, it was so shocking, right?
Yes.
These brothers, they killed their parents. It just seemed like a one-time thing back then. I mean, it was international news. And then now, I just feel like, what has changed?
Right.
I mean,
How
is it
so commonplace now?
Right. Why does that seem almost acceptable in a way, in a grotesque, inhumane way?
You know, my take, especially with you know, the Campbell family and the Peoria family, is that it's really much more in these particular cases due to families doing their best to take care of their adult child who has severe mental illness. So in these cases, I really think that the mental health system is letting the families down, and they just, you know, the parents were shown, the Peoria parents were shown to reach out multiple times trying to get their adult son petitions so that they could get help from the government and get court-ordered treatment so that they wouldn't have to be the ones, you know, forcing this medication on their son, because they knew that there was a danger, and that's why they had reported it a number of times. Same with the Campbell family. They had reported it a number of times, and the police were just in a situation where if it's not actively happening, if we're not seeing it, we can't do anything. But why do we have to wait for tragedy to strike, you know? I mean, we're already seeing the crisis unfold.
Well, and it makes me think, you know, when you're dealing with mental health and medication, this is not a child anymore. This is not a 10-year-old where it's like, okay, Billy, take your meds, it's time, right before you go to bed. This is a grown adult. To make a grown adult who may be bigger than you, stronger than you.
Right. The parents are aging just naturally. Their child is an adult. They're probably retired.
Right.
You know?
I mean, it's got to be so difficult. And, you know, and without, I'm not saying medication is the solution, but maybe it helps. And you just think, if I can't even give my child this medication that could help him stabilize, what do you do? What can you do?
So I think that there's such a need to educate families and people in general that, you know, just because you have a mental health issues are so common. But violence associated with mental health is not. And if anything, the data clearly shows that what tends to be the issue is that people with mental health are the ones that tend to be victimized. So that's the first and foremost thing to keep in mind. But in terms of these families with, you know, with their adult children, there are ways to be able to train families. You know, if you see somebody with a psychotic episode, because these were both, you know, cases where probably that, you know, that most likely, we know for sure the Peoria family, that was a part of what was happening.
Right.
How do you deal with that? You know, our inclination is, you know, I want to, you know, show him what reality is because, you know, he's delusional right now. But in their mind, that means like, you're against me too. And that's just going to spike more paranoia and more conflict and maybe make the parent a part of that construct that they're creating in their mind. But rather, saying, you know, I see you're terrified. Like, this scares me too, seeing you so scared.
Right.
So that they feel heard and you're aligned. And you calm your voice down and you make sure you're near an exit and you do not corner them. Dim the lights, calm everything as much as possible. I explain that in a minute, you know, and so I mean, this is real world life or death information that could be given to families. Aside from the fact that, you know, you can call and specify this is a mental health crisis. I may need the police, but this is a mental health crisis.
Right. I like that. I like the fact that, you know, you are giving some tangible, real solutions that people can physically do, right? Dim the lights, lower your voice. Try to be calm.
Yes.
What else? Those are things that I like to hear because, like, you know, we're all searching for solutions.
Right.
So what else can people do?
So in general, the least amount of stimuli, the better. A calm, quiet voice, and reading off of the other person. How are you reacting to this? Is it landing well? Is it not landing well? It's time for me to back away. It's time for me to back away and let you have some space, but really also monitor, do I need to get the officials involved? And knowing the crisis numbers, that's really important too for your local area.
Oh, that's important. Yes. Okay, crisis numbers. All right, Dr. Shier, you are always so wonderful. We had you on the show earlier talking about social media and the emotions behind it. So we appreciate your time once again for coming with us on the 11.
It's so important. It really is, and it's something that's treatable. So I mean, why are we seeing this happen? And why does it feel like it's increasing? It should be decreasing.
You are absolutely right. All right, Dr. Shier, we look forward to having you on again. Thank you so much.